As I'm sure most of you probably know or have gathered, I'm TJ, and Dr. Savar is also with us as well. And we're personalized physical therapy and wellness. And we've been lucky enough to partner up with the Shepherd Center to do this arthritis awareness series. And we had pretty good success over the winter. So we've decided to kind of keep it rolling and do at least one a month here. And today's topic is going to be healthy sleeping. So from the arthritis component, I have several different things that I'll kind of talk about pertinent most specifically to neck, low back, and hip arthritis with sleeping and how that relates to positions and mattress considerations and everything else. But if anyone ever wants me to go a little bit more in depth in any of those, please don't hesitate to ask, because a lot of the presentation today and a lot of the workshop's focus is going to be different sleeping techniques. And the reason we settled on this topic today is through our previous 6 presentations, that was a fairly consistent point of kind of discussion and questions was, hey, what position should I be sleeping in, or where should I put a pillow, or what kind of pillow do you like? So I thought it was best to just put a whole presentation together where we can kind of try to answer a lot of those questions that I heard over the last 2 or 3 months here. So like I said, if anyone has any questions as we go, feel free to put them in the box, or feel free to ask them when we stop and take some breaks for questions here. And so what we'll look to cover today is I want to kind of give some background on the importance of sleep. We're going to discuss good sleeping habits, or at least people that sleep well, consistent habits that they all tend to show. We'll talk through kind of our correct sleeping positions, and then how that relates with pillow and mattress considerations. And then for all those who are here that do have any arthritis or wake with stiffness in the morning, I want to talk through a little bit of kind of morning stretching program as well. So that was one that I kind of initially included, but I wanted to make sure that we kind of brought that up because it really tied in well to today's topic. So some of this material may sound familiar, and my kind of hope and intention today is that everyone learns at least a few things that they can try to implement, because I'm sure we've all had some difficulty sleeping at one point or another, so there's hopefully some good value there. So we'll get into kind of the importance of sleep. So I found, as I was kind of doing my research and putting this together, this quote from the Journal of Sleep Medicine that I think just really kind of sums everything up well. And that's that sleep is critical for the proper functioning of the body, including immune function, tissue healing, pain modulation, cardiovascular health, cognitive functioning, learning, and memory. So that is a long, wide array of topics. And as we think about kind of our general health and wellness, we need to be able to be pain-free. We need to be able to be a self-healing mechanism. We need to have strong immune systems. And then cognitive function, we want to stay sharp. We want to be able to preserve our memory. And then obviously cardiovascular health ties in with all of that and keeping us going. And so that's a little alarming to learn that over 1/3 of Americans have regular nightly sleep disturbance. I had read somewhere that somewhere in the neighborhood of 85 to 90% reported that they had at least several sleepless nights a year, or disturbed sleep nights a year. But over 1/3 on a nightly basis are having sleep disturbance. So that is really pretty concerning, especially as we kind of transition into kind of learning some of the importance of sleep and why we need to be able to be as effective sleepers as possible. So during those phases when we're asleep, some of the things that kind of we are able to work on as a kind of natural restoration of our body is our immune function. One of the other big correlations is sleep and depression. I don't think that's too big of a jump for anyone that's had a sleepless night to realize that it affects our mood and it affects our mental state if we haven't gotten sleep, specifically if it happens for several nights in a row. And I know that there's plenty of patients I've worked with in the past that, for whatever reason or another, potentially related to chronic pain, are just not able to sleep at all for years at a time. And it is absolutely affects their mood, their affect, and can lead to depression. Another kind of important impact of being able to get good sleep is glucose metabolism. So if anyone struggles with diabetes or just managing a steady glucose level, a lot of that is done in our deepest kind of REM cycles. So that is really important function of sleep. And then from a tissue healing standpoint, growth hormone is released in our REM cycle. So that's something we're going to talk a little bit in more depth about is REM sleep. But effectively, that's our deepest level of sleep. And as we'll talk about, it's about 90 minutes of continued uninterrupted sleep before we even enter that cycle. So if you're tossing and turning every 30 minutes, then we're never releasing our growth hormone. And from another study I had read, we're actually about 3 to 4 hours is kind of the peak of our growth hormone release. And what growth hormone does is it helps with kind of tissue reconstruction and healing. So if we have an injury, if we have inflammation, if we have chronic pain, growth hormone is really very critical. And if that's not being properly produced and released, then we're not properly healing ourselves. So it creates this kind of perpetual cycle of pain and inability to kind of heal from that. So one question we get a lot is how much do we need to sleep? This is based on kind of a CDC guideline and recommendation. So starting from infants that need anywhere from 13 to 17 hours of sleep, really by the time we hit adulthood, we need about 7 to 8, 7 to 9 hours of sleep. The recommendation changes slightly over the age of 65, but realistically, we need to have at least 7 hours of sleep a night. There have been studies that have shown that you can get some of the same negative side effects from oversleeping that you do from undersleeping, but typically that's people that are consistently sleeping 10 to 12 hours a night. So if you do it once, it's not that is a concern, but really ideally that 7 to 9 hours per night is the ideal range of how much sleep we should be getting. All right, so I talked about that REM sleep. So I'm going to spend a little bit of time on this slide, and then we'll open up for questions before I go on to the next one, because this is really kind of an important one. So as we think about our sleep, it really kind of progresses through 4 stages. And if you think about it, it's kind of the deeper we get into our sleep, the more stages we progress through. So stage 1 is kind of that initial transition of kind of wakeful mindfulness, is usually just about the first 5 minutes. And I'm sure anyone that can kind of relate to this, where you're first kind of dozing off and waking from that's that stage 1. It's a non-REM sleep, where it's kind of this kind of slow transition of consciousness. But then after about that 10 to 20 minute mark is when we enter our second non-REM stage of sleep. And that is where we see our body temperature start to drop, our heart rate kind of slows closer to our kind of standard resting rate, and we see a little bit of change in brain activity as well. Stage 3 tends to happen really around the 30 to 45 minute mark. And that's when we're seeing a decrease in muscle tension. So even though at that point we've been asleep for 30 minutes, we still have some kind of muscular tonicity and tension. So you see relaxation there. You see our blood pressure kind of dropping, respiratory rate starts dropping, and we start transitioning to a deepest sleep phase of sleep, which is our REM sleep. And kind of as we had talked about the importance of sleep, that is why getting to the 90-minute mark when we enter our kind of deep REM sleep is pretty critical, because that is when our brain activity once again changes. That's when we start to have dreams. They become a little bit more kind of vivid and kind of what we remember of our dreams. But really it's kind of unique to mammals, and it's characterized by the rapid eye motion, the very low tone. So we're getting a total relaxation, and then those vivid dreams. But the reason it's important from a health component is that's where our growth hormone is released. That is where we do kind of our immune repair. We see kind of the benefits of the glucose metabolism. All of this is kind of most active and most efficient in the REM sleep. So if you are unable to sleep for more than 90 minutes, then you're very good chance that you're not entering those REM phases of sleep or stages of sleep and able to kind of properly get the benefit of kind of the reset that we get from sleeping. Now, I know that's kind of a little bit of more in-depth concept, and one that can probably really even be dived into deeper. But I wanted to open up the floor and see, does anyone have any questions regarding the stages of sleep, REM sleep, or anything I've mentioned so far? Okay, so if not, then I will keep going. But as before, feel free to put any questions you have into. Oh, it looks like we got one in the chat here. Someone beat me to it. Can't see the stages. They have names. Actually, they are just numbered. So it's the 3 non-REM stages. So non-REM or NREM, stage 1, stage 2, stage 3, and then REM sleep. But yeah, there's not specific names to those as well. I'm sure if you find different texts, they may kind of label them differently. But consistently, that's how I've seen it classified. You are very welcome. Okay, I want to talk about some of the negative impacts of sleep disturbance. Now, some of this is going to sound familiar because it's basically the opposite of positives of having good sleep. And I'm sure some way, shape, or form, we can probably all relate to how we feel after sleep disturbance, but mood changes are a big one. We discussed kind of the anxiety and depression associated with not sleeping, but it can just really affect our mood in a lot of different ways. There has been a lot of studies showing that it actually affects our kind of cognitive efficiency as well as memory changes as well. So our acuity, our sharpness actually drops when we don't have the proper amount of sleep. And that's not just in kind of individual circumstances of I didn't sleep last night, so therefore I'm not as sharp today, but also in a more kind of broad general sense where someone that sleeps poorly consistently tends to score lower on their cognition and memory tests. We discussed how sleep and proper sleep is kind of critical for our immune response. So obviously, if we have a negative impact on sleep, we're going to see a negative impact on the immune response. And we also talked about the same thing as it came to kind of our glucose metabolism. So you have an increased likelihood of developing diabetes if you don't sleep well, and you actually have a increased likelihood of not being able to manage diabetes if you already have it, if you don't sleep well. And then the last thing is risk of high blood pressure. That can be kind of multifactorial, with the frustration of not sleeping, with pain that may be associated with not sleeping, with the fact that we're not able to enter those lowest phases of respiratory rate, high blood pressure rate, and heart rate. You're going to see kind of higher resting blood pressure levels. So there's a lot of kind of a magnitude of kind of secondary health concerns that are directly related to kind of our efficiency with sleeping. Okay, so this is, I think, a really important one. So I kind of consider that to be our background information on the importance of sleep and how it ties into our health. Hopefully here, everyone can take away at least one thing that they may not have known about kind of habits that impact sleep. If you're feeling impacted or that you're not able to sleep, that you can take something away from this. So habits of a good sleeper: they do not drink caffeine after noon. So being really conscious, it's everything I've seen is kind of indicated that noon is the absolute hard cutoff for when you should stop consuming caffeine. But realistically, 12 hours before you fall asleep would even be more ideal. So if you have a pretty firm 10:30 bedtime, then 10:30 in the morning is when you would want to try to have your last cup of coffee, because it can take up to 12 hours and realistically about 8 to 12 hours to metabolize fully caffeine out of the system. I'm sure everyone knows caffeine is a stimulant. So being able to fully metabolize that out of our system is really pretty important. So noon being the kind of firm number, but realistically, if you know that you have consistency with your bedtime, 12 hours is where you would ideally be. Now, can I sit here on my pedestal and say that I don't ever have coffee after 10 o'clock in the morning? No, I cannot, but doing my best to always try to limit that before noon. Another habit of a good sleeper is limiting alcohol intake and smoking. Both have been shown through research to show that they directly correlate with sleeping. So, from a kind of more anecdotal perspective, um, being able to do kind of months without any alcohol intake at all, they have shown that kind of over the course of those 12 months, that is the month where kind of sleep is least inhibited. So especially if you're getting up ever over those two to three drinks within a day, uh, you may be able to fall asleep quicker, but the quality of sleep is greatly diminished. So that is kind of one thing that is kind of an important distinction, because I've had people tell me, yeah, I drink because it helps me fall asleep. That is correct. It is a depressant. It will help fall asleep, but it can have a negative impact. Now, where the research conflicts is what exactly that kind of perfect line is. If that's 4 ounces of wine before, an hour before bed, may not have that same negative impact, but may give the positive impact. But anything that's been looked at has been consistent to say anything over 2 to 3 drinks within a day is going to negatively impact your sleep. Even if it helps you fall asleep, it's going to ultimately negatively impact. And then smoking, across the board, negative impact on sleeping as well. um, Avoiding long daytime naps, I think that's pretty self-explanatory. But if you're sleeping for 3 and 4 hours during the day, you're not going to be able to fall asleep well at night. So that's a pretty obvious one. And then increasing your level of physical activity and exercise. If you can get 30 to 60 minutes of vigorous exercise in a day, it has shown to improve the quality of sleep. And that, I'm sure, again, is fairly self-explanatory and something that I imagine everyone on here has probably felt or experienced at some point, whether it be going to the gym for an hour or spending some time out in the sun working in a garden. When we are more active and doing more, we tend to sleep better because we're just kind of fatigued and we've used that energy of the day. So there's no kind of restless energy when we go to try to fall asleep. Now at night, this is an important one. And I think in modern society is one that we do a very, very poor job with. And that is avoiding screens and avoiding that blue light at least 30 minutes prior to sleeping. So that means not getting on your cell phone, not watching TV, not scrolling through your tablet, not working on your laptop for at least a half an hour before you go to lay down. Which, everyone is different, but I know a lot of friends and patients I talk to have a real difficult time with that because majority of your life is spent at a screen. So that is something that I really, really stress to people is try to develop good habits with that. And whether that's saying, hey, you know what, read a book for 15 minutes before bed or 20 minutes before bed, or, pray, meditate, find something else that is not looking at a screen for the 30 minutes prior to it. Because the visual stimulation from that kind of blue screen has been shown to really negative impact our sleeping. Maintaining a regular sleep schedule. So this is kind of our body clock, but if you can get on, a pattern of saying I have a 10 p.m. bedtime, I wake up at 6 a.m., that gives me 8 full hours of sleep, and I'm able to do it more consistently. There was another study that showed that people that had a consistent bedtime took them shorter amount of time to be able to fall asleep. I'm sure you probably, again, all had some experience of kind of your body clock or your body alarm waking you up if you had to wake up for work at the same time, or you had to wake up for school at the same time consistently, where you would find yourself just consistently waking up at that time. The same should go for trying to, as much as possible, regularly create a standard bedtime. Using the restroom before bed, continence issues can obviously play a role in sleeping. So the more you're able to kind of vacate prior to, so that you're not getting woken up, within an hour of falling asleep. Creating a comfortable bedtime routine. So this really is kind of a summation of some of the other things I talked about, where whether that means I read for 15 minutes, I pray for 15 minutes, and that's time for me to go to bed at 10 o'clock, or saying, I will consistently go for a walk at sundown, and then I sit and, talk with my spouse for a little while, or I whatever that may be. I like to stretch before getting into bed so that I don't cramp up. There's a lot of different routines you can come up with, but having some consistency helps there. And then don't eat right before bed, but especially sugar. It's kind of similar to the caffeine, but it may seem explanatory, but you'd be surprised how many people make themselves a big bowl of ice cream 45 minutes before bed and then toss and turn for a while, because it takes us a while to process that glucose, and that stimulant is going to keep you up. So being kind of mindful of what we're eating and when we're eating it in relation to when we need to be able to go to sleep. All right, so I'm going to pause on that screen for a minute there and kind of open the floor up again and see if anyone has any questions with anything we discussed there. Okay. So this is really where we're going to get into more specific how it may relate to arthritis, but also kind of different positions and kind of more specific takeaways. So I'm looking at the 3 different kind of main sleep positions. I know there's variations within that, but we're thinking back sleeping, side sleeping, and stomach sleeping. And if you're a stomach sleeper, you're probably not going to love what I have to say about stomach sleeping. But I put them in kind of order of what I would consider to be best to worst. Personally, I have a very difficult time sleeping on my back, so I'm a side sleeper. So once again, there's not a perfect way for everyone to sleep. You have to be comfortable in that position, or else you'll never fall asleep. But I want to at least discuss each one, the advantages, the disadvantages, and then talk through what positioning should look like for this. So when it comes to back sleeping, the main advantage being neutral spine alignment. So we're not seeing any kind of significant rotation, whether that be in our lower back or our lumbar spine, whether it be in our kind of upper back, or specifically in our neck, where we're not fully turned one side or the other with sleeping there. So we're able to very naturally get into a neutral spine alignment, which is going to take a lot of pressure off of the lower spine specifically. And that's one thing we'll look at in a future slide, is kind of how the positioning with the pillows will affect the arthritis or pain in the lower back. Another advantage is it helps to reduce reflux and heartburn symptoms relative to other positions for sleeping, and it's also a lot less load on our shoulders. So someone with shoulder arthritis, rotator cuff issues, shoulder pain in general, back sleeping is usually a really good way to do that. Depending on the level of the severity of the shoulder pain, you may want to put a pillow kind of up underneath, a small thin pillow or blanket up underneath your elbows while lying on your back, just because that will keep our shoulders from kind of tilting forward excessively. As you go into the disadvantages for back sleeping, like I said, for me, it was comfort. Some people just aren't comfortable being back sleepers. It feels unnatural. It wasn't the way we slept as kids or even young adults growing up, so we just don't feel comfortable in that position. That can be a learned habit, but sometimes it's frustrating to try to take the time to learn how to get comfortable falling asleep on your back. But the only real other disadvantage to back sleeping is if your pillows are too high, it can actually make sleep apnea worse, which I'm sure probably is a little surprising to hear, because I imagine everyone knows someone with sleep apnea that uses a CPAP machine. You basically have to sleep on your back. But if you are too propped up, it tucks the chin forward and can close off our airways so that we're actually not getting as much oxygen in. Now, the benefit of a CPAP machine is that it forces oxygen in, and so you're still able to breathe that way. But you have to be cautious not to prop your pillows up too high if you're a back sleeper. So to me, this would be the ideal back sleeping position. So the things we want to kind of highlight, the two pillows up underneath the knees and the single pillow for underneath his head. So he has a really neutral spine. He's not shifting his hips one way and his head the other. There's no rotation. And if you were kind of lay on the ground next to him and look at him, that spine would be totally perfectly aligned. So the kind of part that is maybe a little foreign is going to be the single pillow at the head. Most people have a tendency to really prop their head way up. Now, as we kind of take a step back from that, this person that demonstrated probably has phenomenal posture and has no orthopedic issues. So there's not a one size fits all for everyone. If you find that you're someone that has rounded shoulders or has a head forward position or tends to slump over, asking you to lay on one pillow tonight would probably be fairly torturous. So it may not be what's right for you. You may require a second pillow based on what your posture indicates. Now, in a perfect world, my answer for you would be start with two pillows and then work on some exercises, work on addressing that posture so that you can get back to a position where you're able to use one pillow. But that is, like I said, that is a kind of a big multifactorial a way to address sleeping from kind of a PT attendance standpoint. But my important thing I kind of make to everyone is I'm not telling you use three pillows now. You better use one or else you're going to have problems, because chances are that would probably be a little aggravating for a lot of people. But the main takeaway should be that your head should not be propped up too high. So whatever position that works for you is what I would kind of ideally look for. And then the second thing being the two pillows up underneath the knees. The reason this is important is because it takes a ton of pressure off of our lower back. Now, as we look here, I got a question in the chat actually. Any recommendations if someone has breathing issues? Yeah, so that is someone that may need to elevate the head a little bit. Well, I should take that back. So if possible, elevate the torso slightly to be able to do that. Now, you may have some others that you like as well. But that is really kind of an important part is not to occlude the airways. And if you find that sleeping on your back just consistently occludes your airways, then side sleeping may be a secondary kind of option for you. But that's a great question. But the reason I'm going to show you this and then kind of go back. So this is the side view of someone's hips. So in the picture on the left, if you look at kind of the top left portion of that where it says erector spinae and that top left arrow, that person has excessive curve. Now, I'm not going to ask everyone to turn their computers to the side or turn their heads to the side, but that excessive amount of curve is going to cause pain in the lower back, because if you have any arthritis or any stiffness in your joints there, you will have a significant increase in pain. So when you're lying flat on your back and the legs are totally flat, this muscle that is kind of the downward arrow represents our hip flexors. It is going to pull the pelvis forward. So as you see in kind of the direction of those arrows, as they are kind of spinning clockwise, as your iliopsoas or that downward arrow pulls forward, we spin our pelvis in a clockwise position, and therefore we tend to put a lot of pressure on our lower back. So anyone that sleeps totally straight flat either has really good hip flexor flexibility or they have stiffness when they wake up. And in my opinion, those are the only two options because it's just a tough position. I don't have any back arthritis that I know of or any back issues that I know of. Now, if I sleep on my back without a pillow underneath my knees, I end up feeling a little bit stiff because I'm a little bit tight in my hip flexors. And most of us are, because we spend most days sitting. So as we look at the picture on the right, and this is showing more for the sake of muscle activation, But when we put something up underneath our knees, it flexes our hips slightly so that we are no longer pulling on our hip flexors. And so as you look at the spine model, there's a lot more space in between those what we call spinous processes than there is in this one where they're kind of crammed together. So we have a more neutral spine, and we have a more aligned spine that has a lot less pressure on it. So as I go backwards to that slide, this person on the right and that spine on the right is what we expect to see in this position. But if I yank those pillows out from underneath his knees, I would expect to see more the picture on the left where his back arches, everything bows up, and we get a lot of pressure there. So low back pain, back sleeping can be a really great answer for that, because we know that it's probably the easiest to get straight alignment in all three planes, but it's got to be done with cushioning, or else it tends to be more aggravating than helpful. So the next position we're going to look at is side sleeping. Full disclosure, I'm a side sleeper. I was a stomach sleeper, but I worked very hard to not fall asleep on my stomach, and we'll talk about that for a little bit. But side sleeping allows us to maintain still the neutral cervical curve, and when positioned correctly, can keep us in lumbar spine neutral position. Now, it's a lot harder. We have a tendency, if the mattress density isn't proper to us, if we toss and turn or move and shift during the night, we have a tendency to not stay perfectly aligned. So you start to see some rotation, and you start to see some side bending. So it's, from a lower back perspective, probably the second best option from a spinal alignment. But it may be more comfortable for some people. So if you're just saying, hey, you know what, TJ, I just can't fall asleep on my back, it just doesn't work for me, then this is where I would kind of advise you to try. Some of the disadvantages, though, like I said, it tends to rotate your spine if you move when you sleep. You're also kind of excessively loading your shoulders. So if you have, like I said, shoulder arthritis or rotator cuff injuries, sleeping on your side can be a lot more difficult, especially if you're sleeping on your affected side. And then the last disadvantage is you're more likely to lift your arm up over your head. For anyone with shoulder arthritis or even really shoulder or neck pain, I always recommend that they try to keep their hands below the kind of line of their nipples or chest line, because anything past that, we start to elevate our shoulders, and it changes the complex of our kind of shoulder blade, shoulder, and neck. So trying to keep your hands lower down, which tends to be a little bit harder to do in side sleeping. But if you are going to be a side sleeper, this would be kind of our ideal position. So you can see he's got a single pillow between the knees. So we have kind of equal spacing between each knee. We have kind of alignment with our knees, hips, and ankles. And I think he's got a pillow folded up there, and he's not listening to my advice about keeping his hand below his chest line. But that tends to be a pretty good position from spinal alignment. Now, for someone whose mattress is too soft, using that little towel roll kind of at his side would be a good way to be able to counteract that. So if he was sleeping on a kind of mattress or surface that was just way too soft, then his hips would sink too far into the mattress, which creates kind of a side bend or side flexion that can be a little bit painful or aggravating there. So kind of the ideal position here is either one or two pillows at your head, whatever keeps your head in line with your spine. It doesn't prop it up too high or doesn't prop it down too low. A small towel roll if needed, and then absolutely pillow between the knees. Anyone that sleeps on your pillow on your side should have a pillow between their knees. That's what I do. I don't do the towel roll because I have a mattress that kind of fits me well, but I make sure that I always have a pillow between my knees. It keeps your spine in better alignment. It takes pressure off of your top hip, and it also is a little better at keeping you from twisting and rotating into kind of some pretzel positions throughout the course of the night. Stomach sleeping. I just didn't even do the advantages because I can't in good faith advise people to sleep on their stomach. I know that this is the comfortable position for a lot of people. This is how I initially slept. It is just not good for you. And he is a good example why. So we'll start at his head and go down to his toes. So if you can imagine, if the recommendation that I gave you is to try to sleep at least 7 hours a night, if I asked any of you to turn your head to the left and hold it there for 7 hours, you would look at me like I was absolutely crazy. But that's effectively what he's doing in this position. He's turned his head all the way to the left, and he's now bearing weight through that. And if he's sleeping through the night, he's holding his neck in that position for 7 hours. That is not great. The second thing down is if we look at his kind of mid back, he's turned so that his torquing his trunk kind of towards the right, which puts a little pressure on our mid and lower back, and certainly some pressure on his right shoulder, because another kind of position, that'd be like asking someone to scratch the backside of their hip or buttock and then just having them hold it there. Your shoulder's going to get tight eventually. All right, 1 second. I saw there's another question in the chat there. That's you, stomach sleeper. All right, Dr. Sarwar, you know better than that. You're going to learn from today, and we're gonna transition you to a side sleeper. You know, we look at the left hip. It is hiked up. We've got kind of excessive motion at his hip. Knee is really flexed. On the opposite side, as we travel down the leg, his toes are pointed, so we tend to see someone that gets really tight in their calves. Just a lot of different stuff that goes wrong. And the one thing that we never even mentioned was the lower back. And from this position, especially on either a bed that's way too soft or way too firm, we're either being kind of not supported or we're being supported too much so that we're not maintaining any type of spinal alignment in any of the three planes. So really, really important kind of across the board with that. All right, let's see what we got in the chat here. Okay, so as I kind of wrap with the positions, does anyone have any questions for me regarding positions or anything like that, or any of the stuff that we've covered to this point? All right, I'm gonna keep moving on then. So sorry, these next 2 or 3 slides are a little bit kind of beefy, if you would. It's got a lot of material on them. But the kind of big thing I wanted to stress is there is not a singular right mattress. There's, I have patients kind of ask me all the time, there's not one perfect mattress, and there's not one perfect mattress for everyone. So that's really important to be able to remember, that there's not a right way to do that. Sorry, I saw a question in the chat here. I'm not been able to find any pillow that is comfortable between my legs as a side sleeper. What do you suggest? So with that, what I found works best for me is actually a concave pillow. So it is kind of basically like the cervical pillows that you actually, I think I may show here in a couple. Yeah, something like this, where it's kind of concave like that. I found that tends to work better for me. That's not an area that I tend to, I haven't personally had any issues with that. I've struggled with pillows for my head, but not necessarily comfort with that. Chances are, if it was not comfortable for you, it's because it was either too thick or too thin. So what I would personally do is have someone kind of use whatever pillow you're using right now, have someone take a picture of you lying on your side, and then look and see, are my legs totally parallel and in line? Or are my knees still coming closer like they're touching, or are they kind of pointing away? And that would be kind of my recommendation, is find a pillow that is the right height for you, not so much any of the other factors, but those cervical pillows have a tendency to be pretty good because they also kind of contour to the convexity of the leg with the concavity of the pillow. So that would be kind of my best answer for you, but same thing, everyone's different, but the big takeaway is the alignment's got to be perfect. And if the alignment's not right, chances are that may lead to some discomfort there. So hopefully that answered your question. That was a great question. But if not, I can kind of try to be a little bit more clear on that. Like I said, the mattress considerations are different for everyone. So we're going to talk through different kind of rules of thumb behind the mattresses, but there's not one size fits all. But realistically, the most important thing to remember is that it needs to be supportive for you. That's really kind of what matters. Is if it's not supportive for you and for your spine, if you're not staying aligned, then you're going to end up having trouble. So another quote I kind of included in here is I found from a sleep website, and I thought it kind of summed it up better than anywhere else I was able to kind of find, and even kind of me being able to put it in my own words. But it was that there was a study that found participants sleeping on the firmest possible mattress had the poorest quality of sleep. However, I did that backwards. Oh, no, I had that correct. So the firmest mattress led to the poorest quality of sleep. However, the softest mattress was the easiest to fall asleep with, but showed that people woke up with the worst amount of pain. So as we talk through kind of firmness, softness scales, that's something to be able to kind of keep in mind, if you would, is that based on this was actually a fairly large study. I want to say there was over 1,000 participants, and they found that the firmer mattresses were the least comfortable, but they found that the softest mattresses were the ones that left with most waking pain. So my kind of very generalized recommendation then tends to be semi-firm or as firm as you are able to be comfortable with. And hopefully that makes sense, because if we're saying, hey, firm isn't comfortable, but soft leads to pain and discomfort from not being supported, I want you to have whatever is as firm as you can tolerate, or as firm as you can kind of stand and still be comfortable. Because sleeping on, a hardwood floor obviously isn't getting the job done for anyone. But sleeping on a cloud is not going to leave you feeling very good, especially if you have low back pain or any type of arthritic considerations, because you're just not getting the support needed. So I think that's probably maybe one of the bigger takeaways that I'm hoping everyone gets from this, is that kind of evolves on a scale for everyone. And that's why I think companies like Sleep Number have had success. Those are the mattresses where you can kind of set your firmness scale, and you can do it as a dual zone system. But ideally, it would be as firm as you can be comfortable with, because then we know that you're getting kind of the best possible support for your spine. We've talked about how we align you so that your spine is in that position. And then we've talked about how you should have the least amount of pain waking. And the last thing we'll cover is going to be going through some stretches, but we'll kind of get to that. Someone says, I get my best sleep on the Sleep Number bed. Okay, so then that's really great to know. And that's, like I said, that's why they've had really good success, is because it allows kind of a level of customization that, previously no one had been able to kind of touch. But that would be kind of how I would advise around that. So some other mattress considerations. There actually is a correlation between weight and firmness. So for someone that is a little bit heavier, or is going to be more likely to kind of sink into the mattress, you want something on the firmer side. You're just going to need a little bit more support than someone that weighs 75 pounds, because they're just not going to sink into a mattress the way that someone that maybe weighs 175, 275, or 375 pounds may do. So that is kind of a consideration when you go to look for yourself as well. Side sleepers tend to do better with a firmer mattress. Now, as we kind of think back to that picture where I showed that person with the pillows there, and I talked about how on a really soft mattress, that person may sink their hip down in, so they need a little bit more firmness to support them so that they don't get that lateral flexing at the spine. Now, as another kind of consideration is people with wider set hips or hip arthritis actually tend to do better with softer mattresses. So a little bit of a swing in the other direction. That being that with wider set hips, you have a little bit more kind of surface area to displace. So you're not sinking in a singular point, but instead kind of more evenly distributed across your hips. And then the hip pain or hip arthritis doesn't require the same level of support that the spine does. So we tend to get away with a little softer mattress. And then my final consideration is Based on everything you read, 8 to 10 years is about when you're ready for a new mattress. You should be able to tell if your mattress starts squeaking, if you're seeing it fraying, if you're seeing indentations, if you're feeling those things. You should be rotating it, but realistically, 8 to 10 years on kind of most standard mattresses is when it's time to be updated. Some of the new memory foam ones I've read can actually last up to 15 years, which is great. But realistically, you should be kind of aware of that at the decade mark, that it may be time to consider that. And being that we ideally spend a third of our lives there, if capable, I think investing in a mattress and a good quality mattress that kind of fits your needs is really one that's important, because of all the health reasons we talked about with how important sleeping is, and just orthopedically how that plays a role as well. All right, let's talk through some pillow considerations. So I try not to get too much into specific pillows, like I don't get into specific mattresses, because I'm not really a salesman, but more just a PT that has seen kind of a lot of trends and has read a lot about this. So as we look at our sleeping position, kind of like I talked about with the knees, we need the right height pillow for us, because if your pillow is way too big, you're going to get this kind of side bending, and that's a good way to kind of end up with that kink in your neck, if you would. So we want a pillow that allows our spine to stay fairly neutral. And if we haven't been sleeping this way and it's been a long habit, it's going to feel really awkward to try to switch to a neutral spine, because I'm sure a lot of people probably feel most comfortable with their head bent to the side with a big plush pillow, but that may not be the best orthopedic way for us. Same thing for the back sleepers. Too much of a pillow tucks the chin, flexes the spine, and can put us in a little bit of a strange position relative to something that's able to kind of support us and create a good neutral spine position for the pillow there. But regardless of the position, just like with the spine, with the mattress, it's all about head neck alignment. They make those cervical ergonomic pillows now. Those tend to be really great for back sleepers because it supports the neck. It keeps you in a neutral alignment. It is not always like I said, the most comfortable thing to get used to, because you probably, if you have a forward head position or your tightness in your neck, getting back into that position may feel like a stretch in itself. So it may be something that needs to be worked back to, but is a really good long-term solution for supporting the neck during sleeping. And as I've alluded to and mentioned several times, I don't want you propping yourself up too high, because that's how we tend to occlude the airways and can really impact our sleeping, especially with sleep apnea. Okay, does anyone have any questions with any of that so far? Okay, so what we'll kind of look at then is going to be kind of our morning stretches. So I've got 4 different stretches that we'll go through. These are fairly generic, and they're looking at spine, upper kind of mid back, lower back, hips primarily, because short of the neck, those are the areas where people tend to wake up kind of stiff and having pain. So that was kind of what these were designed around. Are you guys able to hear the volume of me speaking there?
No, we can't hear the volume.
Okay, so I'm going to show the video a couple times, but what I'll do is actually do a little better job of actually introducing it. So the exercise I'm showing here is the pelvic tilt. It helps with lumbar flexion extension range of motion and kind of lumbopelvic control. So what I'm doing is I'm lying on my back, my knees are bent, and I'm feeling like I'm rolling my hips back so that I'm pressing my lower back flat into the table. So this is going to engage your glutes, it's going to engage the abdomen, and it's going to open up the joints in the lower spine. This is a really great one to do before your feet ever hit the floor. Because once our feet have hit the floor and gravity sets in, we're kind of loaded and it's a lot harder to kind of loosen up. But if you can go through these before ever kind of getting up and walking around, you tend to have a better response first thing in the morning. So I'm gonna show this one more time. So like I said, it's really all about kind of our lumbar pelvic mobility. So we are trying to roll the hips backwards, like we're tilting our belt buckle back or drawing our kind of belly button down towards our spine. Or the other cue I'll use with people is that I'm tucking my tail. But as you can see, I'm rolling my hips backwards to try to take some pressure off of my lower back. All right. So the next one I want to show you here is going to be our trunk rotation stretch. So same thing is going to be, knees are going to be bent, lying on our back. Performing this exercise short of any pain. That is an important variable. Now I go pretty far with it because I do this one fairly regularly. But if you can imagine, if you've been sleeping for the 7 to 9 hours and you try to go all the way, it's probably going to feel like you're trying to open up a door that hasn't been opened in 20 years. So I want to be really kind of gentle with it as you start, maybe going halfway and then slowly kind of rocking back and forth. But that's kind of the idea, is you're looking for maybe 10, 20, 25 repetitions of rocking the knees back and forth to be able to allow that lower and kind of mid back to loosen up a little bit there. What if you have osteoporosis in the lower spine? So that's a great question. So with osteoporosis, none of the exercises I show you are ones that just by itself would prevent you from doing them. Specifically the pelvic tilt, being able to be competent with that is probably one of the most incredibly important exercises that someone with osteoporosis should be able to do, because with osteoporosis we need to be as strong and stable as possible without overloading or overbearing those joints. So all of these exercises are going to be done lying flat, so we're not kind of joint loaded. Now, so from that regard, the pelvic tilt is really critically important and should not be painful. This one may be, depending on the individual, maybe need to modify to not go as far. So as I talked about, as well, I'm kind of rocking back and forth, that person may want to stop there and then go back. So instead of kind of we're just rocking in a shorter range of motion. And then as they get more comfortable, then they can start to go a little bit further. But it's all going to be individually kind of dictated based on how you feel. We're not pushing through pain with this, but if you're not having any pain, then no, osteoporosis would not be an issue for any of these exercises I included. And the first exercise, the pelvic tilt, is one that I would actually highly recommend someone with osteoporosis performing. I'll show it one last time, and then we're going to move on to the next exercise here. Osteoporosis with degenerative disc. Yeah, same thing goes for that. Now with the degenerative disc, that's kind of more arthritis. So these stretches are kind of specifically tailored to degenerative disc lower backs, because that is kind of a normal part of aging, and most of the kind of aches and pains and things that we tend to kind of feel, it comes from kind of a shrinking of disc height, so that the joints, or the bony part of the joints, kind of sit more closely on top of each other, that causes that kind of stiffness or aching. I go back to, with all these, I think all these actually are kind of specifically tailored to someone with low back arthritis or degenerative disc. But not all back arthritis is created equal, and not all degenerative discs present the same. So you should be performing this in minimal pain ranges, and you should feel better after doing this. So that is kind of an important distinction. All of these, it's not no pain, no gain. You should go as far as your body will allow you to, with the understanding that as you work on them, slowly you'll find that you can kind of move a little bit better. but it should not be painful, but it certainly are all ones that I would recommend someone trying to do. So the third exercise I have here is going to be our double knee to chest. Couldn't remember which one I had next. So same thing, hip stretch, gluteal stretch, and then certainly a lower back stretch as well. And I'm pulling both knees up to my chest. Now, some people may need to start where they're pulling one knee at a time and then kind of slowly pulling in, but realistically, the flexion action opens up space in our lower back. It stretches the glutes out, and then that is really how we're able to take some pressure off. So looking specifically at the degenerative disc disease patient population, this is one that tends to feel really good for them. Show that again. So our final exercise here is going to be, we'll call it piriformis stretch. So this is more of a muscular stretch, especially for your hip pain listeners. So anyone that wakes with kind of pain in the outside of their buttock or the outside of their hips, this is a good stretch for this one. All right, circling back, Hermina, amount of reps. Yeah, with those first ones, I usually would look at about 3 sets of 10. And to begin with, 2 sets of 10, working up to maybe 3 sets of 10 to 20 is usually a pretty safe ball game. Typically with those, it's a little harder to kind of overdo, if you would. But this one's going to be a little bit different, where this one, we're not doing as many repetitions and we're focused on longer holds. So we're coming to that position and we're pulling our knee towards our opposite chest, and you're going to feel a big stretch in the back side of the hip. So this is for all the people that wake up with stiffness kind of in the buttock, the side of the hip, or even into the lower back. If you have pain in the front of the hips, this one may not be as comfortable for you. So just go as far as it kind of feels comfortable. But typically I try to hold the stretch for about 30 seconds or so. And I would try 1 to 2 on each side first thing waking. All right. And so then the last concept I want to talk about is going to be kind of the role of physical therapy within this. So I really have this more as in a more general sense, because, we spoke in kind of sleeping positions and, things to consider. But the kind of the only reason that we didn't discuss is, specific injuries that keep people from sleeping or specific pain. So kind of the PT's role in sleep specifically, similar to, role with addressing arthritis, where we're focused on joint mobilizations. So we're getting kind of restoring the normal motion mechanics of the joints. We're working on the soft tissue, the muscles, the tendons. We perform what we call muscle energy techniques, as well as proprioceptive neuromuscular facilitation techniques, or getting the muscles kind of working and firing properly and balanced and sequenced. We do a lot with kind of our progressive therapeutic exercise program. So that's really from kind of a PT perspective, the type of techniques and things we're implementing to be able to help kind of restore someone's, postural alignment, or kind of help recover from any type of injury or surgery that they've had, so that we're able to get them sleeping